Hi, so I'm Gemma from Remedial Therapy Clinic, and today what I wanted to talk about was lower back pain. So, lower back pain is one of these common ailments that I see people coming through my clinics, which is unsurprisingly, as when we look into it, is about 1 in 3 of adults in the UK alone struggle with lower back pain. So, how do we go about sorting out our lower back pain? Do we go to the doctors or take our paracetamol and hope for the best and that the pain will disappear, and continue possibly down that route with looking at the potential of surgery, which can help for some but can often cause more issues? Or do we look at trying to look after our backs and heal ourselves? So hopefully you will come to a therapist like myself that will really try to understand what is going on with your body and try and get away from what the symptom is and the pain to really see what the cause is. So it's all about unpeeling the layers of the body to really understand what the cause is. Because once you get to the cause, you can actually start healing your body. So, what can cause lower back issues? Well, there's quite a few really, and everybody's different, everyone is unique. So, what you would need to do is really understand what's going on in the musculoskeletal system. So, that's this sort of spinal structure and the bones and the fascia that holds that all together. So, for instance, if you stood up now, and you would start to really contact with your feet, try and kick off any shoes so you're nice and barefoot and you're stood up. And you might find, if you really listen to your body and just sort of see what your feet are doing, that there might be an imbalance going on with your feet. You may find that you're going outwards, maybe on one side more than the other, which we call pronation. Or you might be coming inwards, more inversion. And you might then start feeling restrictions in the feet and the toes, and then working up then possibly then into the knees, because what's going on with the feet will then start putting pressure onto the knees as well. And then that will continue up into our hips. So you might then want to start thinking about, okay, how are my hips feeling now? So imagine your hips like a bowl, sort of sitting up on those two pins, those legs of yours. And what it should do is feel nice and even, like it would do on a table, and it can hold that liquid and fluid nice and comfortably, nothing's falling out. Now, if you've got imbalance going on with your legs and your feet, you will probably find that your hips rotating and tilting to certain points. So it can be tilting forward, so you might feel like the water's flowing out from the front. It might start feeling like it's tipping out from the back, so you've got more postural rotation. It can also go from the sides as well, and it could do a mixture of both, so they got a bit of rotation going on. So that causing that pressure and that imbalance causes this real pain and discomfort within the sacroiliac joint, which is the lower back coming right down into the sacrum, which is the last part of the spine, which then attaches to the iliac, the ilium, our hip bones. So that sacroiliac joint is so many nerves, where the sciatic nerves coming out of, which I'm sure you've heard of. And you've got an awful lot of ligaments and tendons, tendons from the piriformis, which again can cause aggravation to the sciatic nerve. And this will cause a lot of pain and discomfort, because when the form of that sacroiliac joint, because it's not normally a nice lock and key, but if that starts tilting to one side or the other, those ligaments and those tendons having to start working much harder to keep and protect that sacroiliac joint and our spinal cord. So this is why you're getting pain. Your pain is highlighting to you that something isn't right and it needs something to do something about it. So that's an element of what's going on this musculoskeletal part, which you're probably starting to feel more when you're tuning into your body. You can feel what's happening in the imbalances. We've also got our organs to take into consider. So, for instance, the organs, the sigmoid colon, which comes down our left-hand side, down into our hips, rotates slightly, does a nice little loop thing going on, and then tucks down then behind our bladder and then out for our anus. So this sigmoid colon, very key function of our body, and has an awful lot of nerves and arterial supply, which actually has direct attachments to our lower back. So this is called the mesenteric nerves, and the inferior and superior, and you've got the mesenteric artery as well. So as you can imagine, if there's a lot of tension going on with the sigmoid colon here, you will be getting like a sort of kickback from that, from a pressure perspective, back into the arterial and into the nerves. So this will be causing inflammation again within your lower back, which is quite interesting as well, because when you think about the organ, it has an awful lot of emotional aspects to it as well. So if you've probably heard of tying yourself up in knots and worry, a lot of worry and stress and anxiety can really resonate within our sigmoid colon. And our intestines and our small intestines. So if you can imagine, that's all getting sort of short and tightened with this over worry, which causes things like IBS and things. That is then pulling your body forward, causing more tension and restrictions, and then that's causing lower back pain, because your lower back pain is now being stretched and it's being pulled, so it's having to contract to protect itself. So we got these emotional parts. That's just one emotion. If you can imagine other emotions, like if you think about your hips, since us humans have started to now walk up on two legs, awful lot of the weight where it used to be on our hands and our knees is now in our hips. So our hips are having to hold and support us so much more. And if you can imagine, if you talk about support and you ask yourself, do I feel supported? Am I being supported through this? And the answer might be no. You'll probably be feeling like this lack of support is resonating within your lower back as well, which is why we often feel out of control, or we need to control, which causes a lot of tension within our lower back and our SI joint and our hips. So coming from that, you also then have other issues like how controlled we feel, or how anxious we might feel, how connected we feel with the ground. So we've just been sort of experiencing how your feet feel attached you to the ground. That it can also be if you feel trauma or stressed and anxious, those feet are communicating back up to our brain. And if we're in our fight-flight mode, which is that more stress, that's resonating back to our feet to be sort of more in control, ready to move. So they tend to be very tight. You might often find that your feet are being clawed. You're feeling that tightness and tension within the lower of your sole of your foot. So it's really about when we find that there's these emotional aspects, is how we can release our body from these unresolved emotions as well. So this is really just touched upon on a few issues that can resolve in lower back pain. Now, it could be one of those aspects that I've mentioned, but it could most likely going to be a combination of several of them, really, because once your emotions start, your body reacts to that. It gets tighter, it pulls into that direction, which can affect the muscles, it can affect the organs, and then those muscles and organs affect the skeletal system, which is then causing this imbalance, and then it's affecting the nerves and the tensions and arteries. So it's a real little layers of going on, and the key sort of my role as a therapist is to make to see and to understand that, but also to give you that information as well, so that you are enlightened with this information, and with enlightenment you get empowerment, and with empowerment you feel much more in control. You don't feel like you're just left to just, you have no other aspect and nothing you can do about it, but you are in control. And actually, when you feel in control, you feel better already. It releases that pressure, that tension, that sort of aspect of your body. So if any of this sort of has resonated with you, and you unfortunately are suffering with lower back pain, because I have experienced it before, so I'm fully aware of what it is like, and it's quite debilitating, really. So if like I said, if this resonates with you and you would really like to understand what's going on with your lower back and what the causes are, and really want to empower yourself to find to give yourself those techniques and to start that real healing process for yourself, then please give me a call. I do an online consultation for an hour, which includes a guided meditation as well. So that effect helps look and get you to really connect with your body too, and see the emotional aspects that are probably going on as well. And yes, try that. If it does resonate with you, give me a call. Let's do a consultation, and hopefully we'll get you on the road of healing yourself. Okay, take care. Bye-bye.